I 100% agree that there is a need for awareness about multiple sclerosis, particularly in the Black community. We have many patients here in the United States who have never heard of MS prior to their diagnosis, who may have also had physicians or other healthcare providers tell them, well, you're Black, you can't have MS. And so I think there needs to be a lot of education, not only in the general public community, but also in the neurologist and, doctor community, to make sure that basically everyone understands that anybody can get MS.
When you see that what you're doing is helping others, to be honest, I have no regrets. I have no regrets about it at all. It needs to be done. I think the Black community needs to speak up about illnesses more. It's a life and death situation.
And so I think that's where we are in terms of the research and in terms of many of the conversations that I'm having with my colleagues all over the country and frankly all over the world, to try to understand why we're seeing some of these differences and kind of what are the factors that are playing into that. So, we have come a long way just in even talking about it, just in even addressing these underrepresented communities, but I still think we have a long way to go. Hi, my name is Dr. Mitzi Joy Williams, and I am a board-certified neurologist and a fellowship-trained neuroimmunologist. I'm also the medical director of the Joy Life Wellness Multiple Sclerosis Center in Atlanta, Georgia, in the United States.
Hello, my name is Natalie Bursari, and I am the founder of the non-profit patient organisation based in London called The Nerve of My Multiple Sclerosis.
And I'm Brett Drummond. You're listening to the ECTRIMS podcast, the official podcast from the European Committee for Treatment and Research in Multiple Sclerosis. MS is a disease that impacts almost 3 million people globally. Importantly, we know that MS exists in people from diverse cultural and ethnic backgrounds. As there is a growing push towards taking a more personalised approach to the treatment and management of MS, it is critical that we understand the unique issues, both socially and clinically, that may arise in people living with MS of different ethnicities. In this episode, my two guests, Mitzi and Natalie, have both played a significant role in identifying, highlighting, and raising awareness of issues faced by Black people living with MS. Mitzi and Natalie, thanks for joining me.
So glad to be here. Thanks for having us, Brett.
Thank you for having me.
So one of the things that I'm really excited about for this episode is that we have two very different perspectives from which to discuss a really important issue, which I think is going to make for a fantastic episode. Natalie, I wonder if we could start with you. You've written a number of really insightful articles about your experience as a Black person living with MS, including some focusing on specific stigmas that have been associated with that. Can you talk us through what that's been like, and I guess how it's also led to the founding of your non-profit organisation?
So I guess it kind of just started with my own personal story, and I literally was just advocating, and then I guess I just started wondering, started getting curious why there wasn't enough information for Black people living with MS. And it just started from there. And then I started making friends. I started my own Instagram account and started advocating, hoping that I would meet, more Black people with MS. And it only came up to a couple of months until I started meeting people. And we all realized that we had the same kind of issue. Like, we didn't feel like this illness had anything to do with us, because even the charities themselves, as much as they're quite helpful, there wasn't much about Black people with MS, anything about our culture, anything like that. So we kind of just felt, a bit left out with no answers. And sometimes I would ask my doctor, more questions about it, and she could only just give me just a generalized view on it. So it just started with that. And then I started to look a bit deeper into it, started to figure out, is there any research going into it? And I found out in Europe, especially, there's not a priority. So I just thought, instead of sitting around waiting for us to be made a priority, just started getting a group of people together, Black people with MS, and then we just started advocating, just a small group of us online. And then I just realized that it was bigger than what I thought it was. So I decided to open up a non-profit, was doing it part-time because initially I'm a web designer. I was working for myself. And then I just realized that more time needed to go into the non-profit. So I'm full-time now. But it is something that is definitely it was a challenge because it was two different things. When I say culture, there's the culture barrier as well, especially from my family. There's a few aunties, uncles and cousins that don't speak to me today because I advocate for people with MS. And it's more like the shame of knowing that someone in the family has this disease, that no one wants anybody to know about it. And I realized I wasn't the only one feeling like that, which is why a lot of Black women especially, they don't reach out. So when I was doing my events, I didn't think anyone was actually going to come. And then loads of people came, and then it started to grow a bit more. So it just continued from there. But it's hard because it's like they deal with a lot of racial discrimination from the healthcare system as well. So it's like you can't speak to your doctor because your views are ignored or you're not treated right. And you can't speak to your family because it's not something that you're supposed to be talking about. So you find these people like going down this rabbit hole of, oh my God, I'm by myself. Nothing out there says it's for, Black people with MS, don't want to go and see my doctor, can't speak to my family. So it's like now we've built a community where people can feel, I found my community now. I can talk to people about this. It's not a shame. So it just started from there and it just kept on, growing, bigger and bigger.
And I think that's really interesting, and Mitzi, obviously keen to get your thoughts on this as well, but it sounds like for you, this started right at the point of diagnosis, and we know that disclosure for people living with MS, generally is something that can be difficult, but often we talk about that with employment a lot of times as being somewhere where people don't want to do it, but we know that getting a support network from the earliest days is really important. But you're describing a situation here where even disclosing to your family can be tough. I guess firstly, how did you go through that process and what it was like for you? And then following on from that, I guess, Mitzi, your thoughts on, how as then a healthcare professional do you help guide a person going through this understanding there's this extra layer that needs to be managed?
So I think with me, when I was younger, I say that my aunties, the ones who are not talking to me, I don't think they'll be surprised that, I would speak out because I was very outspoken when I was younger, and it was something that it's not something that you do. When adults are speaking, you don't speak, you don't ask questions and things like that. So even though they're not speaking to me, I do kind of think that maybe they're not surprised that I'm the way that I am. I've come out, I've spoken out because one of the things I did ask one of my aunties is that, if anything was to happen to me, would you know what medication I'm taking? If a paramedic, because MS is very unpredictable. So if anything could happen to me, I could be unresponsive one day. If you had to call an ambulance, would you know my medication? I asked her all these things, all these medical things about me. She couldn't answer one question. And this is the reason why we have to speak up. And I don't believe in hiding things, because I feel like it's kind of like in the Black community, it's life or death. I think the main thing with my auntie is that she felt like I didn't believe that God would get rid of my illness. So because I went to see a neurologist, that was like a betrayal. So that was her reason for not talking to me. And my other aunties and uncles, you'll see they've got their other reasons as well. So it's something that I feel like we've gone on too long with looking at those type of things, and we need help. And I feel like the younger generation are, willing to talk, but it's their loyalty to the older generation. It's a bit hard for them to speak out. So they are they are grateful that they have places like, platforms like my one to even speak up. And I want to do even more platforms for them, because even just seeing an interview with Black people on TV talking about MS, unless you're a celebrity in the UK, no one's talking about it. No one is bringing a Black person on TV and speaking about it. So they don't link you with MS. They'll look at you. Even a doctor said to me one time, oh, it's a shame that, you have MS. Black people are supposed to have sickle cell. White people are supposed to have MS. And he was just like an older a white doctor at the time. And that was the perception. And in the UK, it's still the perception. So my navigation was very difficult. I had to choose between, am I going to lose family members and just hide away and feel ashamed about something I can't control? Or am I going to go out there and help other people? And so many people have given me messages like, I didn't even know I could have children until, I saw you advocating. When you see that what you're doing is helping others, to be honest, I have no regrets. I have no regrets about it at all. It needs to be done. I think the Black community need to speak up about illnesses more. It's a life and death situation.
Yeah, so I mean, you said so much, Natalie, that it's hard to know where to start, but I'll start here. I 100% agree that there is a need for awareness about multiple sclerosis, particularly in the Black community. We have many patients here in the United States who have never heard of MS prior to their diagnosis, who may have also had physicians or other healthcare providers tell them, well, you're Black, you can't have MS. And so I think there needs to be a lot of education, not only in the general public community, but also in the neurologist and, doctor community to make sure that basically everyone understands that anybody can get MS. So if someone comes in with those typical symptoms, be thinking about MS. Don't think about what you learned in your textbook, only what you learned in your textbook in medical school or in training. But think about MS if someone comes in with those typical symptoms, no matter what they look like, and along with kind of talking to people about disclosure, sometimes it can be a difficult conversation, right? I do have some patients who haven't told their children that they have MS and they have adult children. I have some who haven't told family members, for various reasons, some of which you have already talked about, such as stigma, as well as shame. Some of them don't feel like they want to be a burden and don't want their family members to worry about them, which in theory seems like a good idea, but in the case that you do need some help and you do need support, it becomes difficult, when people don't know that something is wrong with you, right? And so, we navigate all of these things in the clinical setting, just trying to, first grapple with diagnosis, talk about what's the best treatment plan, and then certainly deal with many of these social issues. And I will take a step back and just talk about, kind of the history of understanding MS in the Black community. When I came out of training 20 years ago, we did not think that MS occurred very commonly in Black populations. However, I live in the South, in Atlanta, Georgia, and I've lived in Georgia most of my life. And probably about 70% of the people sitting in my lobby at my MS clinics, all of my places of practice, were Black people. And so there was this mismatch between what I had learned and what I was actually seeing in the real world. And that really led me on a journey to try to focus on research, not just about MS in the Black population, but looking at general research and how can we increase diversity in our clinical research so that we don't have to go back and do extra studies to look at these populations, that we've already done the work on the front side and we made people aware of their options, And so I think there's a lot of work to be done, but it's very encouraging to see, people like you, Natalie, and your organization. There are some organizations in the United States, such as We Are Ill, which are focused on Black women with MS. And so it's been really empowering to see so many patient advocates coming to the forefront, really leading the way, to raise awareness and to give people a voice who really did not have much of a voice prior.
And it's interesting to see, some of the things that came up there, and in one of the conversations we've had a bit recently, and some other things they're doing, even just talking, you talked about medical textbooks and how they didn't discuss, that MS was a disease that could impact on Black people. I know there's a push now for the fact that when you look at images in medical textbooks, they're all of white people. And this is what's sort of fueling some of these misconceptions. And so I know there's a push to increase some of those things. I'm curious, Natalie talked a lot about raising awareness and conversation in the Black community, which is amazing. And, take time to just, thank you for the work that you've done on that, because conversation is so important to reduce feelings of isolation, which you also described, which we know are really common in people living with MS. I'm curious, Mitzi, for you, are these sort of conversations also happening amongst neurologists and healthcare professionals? Is there an ongoing conversation about trying to understand these issues better?
Absolutely, right? So there's really been a rise, I would say in the past, I could say the past decade, but really in the past 5 years ago, I think there's been an increasing light being shown upon or shined upon social determinants of health, right? And those are the conditions under which we live, eat, work, play, grow, age, and recognizing that these are really, really important to health outcomes. Because one of the difficulties is when I looked into research and when we started doing research focused on MS, particularly in Black populations, like many other disease states, the outcomes seem to be worse, right? So of course, everybody doesn't do poorly, but when you look at most of the data and most of the research that's been done, we found several key things. The incidence of MS, at least in the US, seems to be highest amongst Black women, and the outcomes in terms of disability, in terms of vision problems, in terms of cognition, in terms of MRI metric, all of these things seem to have more severe or less favorable outcomes in members of the Black community. So there really has been a push to try to understand what is causing these worse outcomes. So is it some underlying biologic, nuance, right? Because by and large, most of us are the same. And when we think about race is really a social construct, right? It's not a biological construct. So are there some, kind of small biologic differences that may be contributing, that may be more common in certain populations? Or is it more of the social determinants of health, right? Socioeconomic status, right? People's ability to get to the doctor, people having culturally competent doctors, people having doctors who would suspect MS and diagnose them in a timely fashion. And so I think that's where we are in terms of the research and in terms of many of the conversations that I'm having with my colleagues all over the country and frankly all over the world, to try to understand why we're seeing some of these differences and kind of what are the factors that are playing into that. So we have come a long way just in even talking about it, just in even addressing these underrepresented communities, but I still think we have a long way to go.
And I know you recently published a paper, an author on a recent paper in Neurologic Clinics titled Multiple Sclerosis in Black and Hispanic Populations Serving the Underserved. Are those the things you just described? Are those the sort of things that are discussed in that paper? We'll make sure that there's a link for people to be able to access that.
Absolutely. So that was a great collaboration with Dr. Liliana Amescua, who is, also a neuroimmunologist in California, does a lot of this work focused on the Hispanic and Latino population. And also two of our fellows, Chris Orlando and Maima Akinsanya, who are now completed fellowship and our colleagues as fellow neuroimmunologists. And so that article really just kind of focused on what is the data that we have, right? What is our understanding? Again, we know more about the incidence of MS in these populations in the U.S. There is a push to try to get these data in other parts of the world, right? Because many of my colleagues, when I go to conferences like ECTRIMS or other global conferences, the question is, well, where's the data in our population, right? So trying to expand that beyond the U.S. But also we talked about, what we understand about outcomes, the role of social determinants of health, and really what are the next steps, right? So the next steps are trying to increase diversity in our clinical trials from the beginning, but certainly for those where we don't have that data, to try to go back and look and see how we can understand, how different medications may behave in certain populations, and again, the interplay of those social determinants of health and how they affect outcomes.
Natalie, I guess for you, have you also felt that same sort of shift and change in momentum over the past 5 to 10 years in terms of how the research and the medical community are starting to place a focus on this, or has that not yet reached you? I'm interested in your perspective on that.
It's a little, I think in Europe we're quite slow. It's actually really frustrating, because especially when they've got so many, like you're talking about that big conference, but we've got so many things here in Europe, but they're just not using it. They like to say they're going to, but it's like they put those kind of equality, diversity and inclusion plans in place, but they don't really start. We don't know where they're starting, because they say, oh, we're going to make it a priority this year, but then when it comes to clinical trials, the fact that, you want to make it more diverse, but you're not looking at the people signing up. You're not really paying attention to it, and when it comes to Black people, the word clinical already scares the hell out of them. Like, what is that? You've got to realize that these people are very vulnerable, and a lot of testing is in the history when it comes to testing Black people, especially in the UK. There's been a lot of that history. Not too long ago, even with COVID, they wanted to do tests in Africans when we were on lockdown here in the UK, when it wasn't that COVID wasn't in Africa, it was there, but it's not in the mass as it was in Europe. So we were thinking, why don't you test where it's the worst? Why do you want to test in Africa first? There's always that kind of worry. And there's a lot of apologies that were coming from the past of testing Black slaves when they came to the UK, especially women. They would test on them without any anesthetic. they were just animals, really. And it's just that idea of testing. Even sickle cell is a massive thing in the UK, and it's put a lot of cost and burden on the healthcare system. So they need a lot of, black people to donate. And if you hear what they say about donating, the things are like, oh, what are they going to do with our blood? Are they going to clone us? Are they going to do this with us? Are they going to use it? There's still that worry there, still that thing there. So it's more like, okay, but we don't have many black neurologists. I honestly believe I found the one and only black neurologist in the UK that specializes in MS, because we have a few, but they specialize in like Parkinson's, stroke, migraines, but not MS. I found one person, and there is a lady who's trying to push for more black researchers, because I feel like when we know that there's people that look like us in those places, it's a bit easier for us to take in that, okay, we're a bit safe here. But if we go in a place full of, white people wearing this white coats and stuff, we panic. I'm like, no, this is not a place for us. So they've still got that mentality. So it's something that's very vulnerable. But I believe because they don't make a fuss about it, I feel like with the scientists and researchers, they're like, oh, well, if they're not coming, then let's carry on as we are. There's nothing to say that they're doing anything to change. I think we're moving really, really slow. By now, I feel like we should be on research. I think the register, the MS register, there's less than 100 black people who identify as black people on the MS register, and there must be about 18,000 plus on that register, and there's not even 100 black people on there. That says a lot. So where is the urgency for that? It's just moving for my liking. I would like it to go much faster, because I know research takes a long time. Getting the right medication, have to go through the right checks, trials and everything takes a long time, and we're not even on research. So I feel like it's going way too slow in Europe, and there's so many things here that says that we should be kind of ahead. So to me, I'm a little disappointed. I'm trying to push the narrative to get them moving a bit faster.
Yeah, and I would just add to that, I don't want to give the impression that we are moving at lightning speed either here in the U.S. Like, we have some champions, who are really involved in this work and who are really pushing the agenda. But there also is still a lot of work that needs to be done. And one of the things that I like to talk about when we talk about research is that it really is a multifactorial answer, right? There have always been these sayings like black people don't want to participate. So when we talk about research, we often frame it as participation or lack of participation, which to me puts the onus on the patient, right? Like they don't want to do it. And in many cases that can be true. But we recently did a survey, well, maybe it's in the past 5 years, with the MS Minority Research Partnership Network. And we surveyed, 2,500 MS patients here in the U.S., 200 Black patients, 200 Hispanic, and maybe about mostly 2,000 white patients. And what we found was that most people across all of those ethnicities and races had very positive thoughts about research, but they did not know where to find out about research, or their doctor never asked them to be involved in research, So I think that, there needs to be education on the part of the scientific community, not to assume that people don't want to be involved, but to make sure that we're educating, that we're diversifying researchers, but also diversifying the staff, right? So again, it takes a while for somebody to go to medical school or, get their PhD. We're not going to turn over the workforce in a faster, a very quick manner, but we can at least look at, our staff and make sure that that's representative, right? So when people are talking to those about trials, your coordinators, your nurses, your MAs, et cetera, that are involved, is there a way we can look at that staff and diversify that staff as well?
I think what's really interesting from both of you talking about this is the importance of representation. But I think probably going beyond that, it's also the importance of visibility of representation and making sure that, in all aspects of this, from trial participants, people living with MS, through to, staff, and then the lead researchers, that we're making a real point of making sure that they're out there. You have both done a fantastic job of doing that, and pleasing for me before this the first time that the three of us have had the pleasure of talking, or the pleasure for me and the privilege of getting to talk to you, but I was well aware of the work that both of you are doing beforehand, because you've made a real point of trying to be out there and be vocal about this. Messages that you talk to colleagues, I guess, or other people in the Black community, Natalie, for you, what are your messages in terms of what people can do to help make that more visible and the importance of it?
I think it's just some people feel like even going online is one way of advocating, but even just speaking to your family members, people that you trust, is advocating, because they will talk. We always talk when we get together as a family. Everyone likes to talk, so it will all get round eventually. But I would just say, just even with me, I've been very lucky because I've got friends from all different backgrounds, white, Chinese, Filipino, and it's good to have just that. If you have friends from different cultures, these are the things you talk about. Because I feel like sometimes when I'm talking about race, inequalities, some people get really uncomfortable talking about it. And they said, but why do you not feel uncomfortable saying that, But because I talk about it so much. It's normal for me. And I feel like the more we talk about it, the more normal it is. Nobody has to feel uncomfortable. So I think that's something that I would say. Just keep talking about it. It's not something that is anything to be ashamed of. It's just something to just have like an understanding. And I'll go to what Mitzi was saying about, being very positive about enrolling in these trials. It was the same for me when I go to when I have my community events. I always ask them, and I bring neurologists who want to get involved in the projects and stuff like that. And they say, okay, we've got this trial, and it's would you be interested? And you'll see how everyone is just like, oh, can I get that number? Can I, how do I participate? They actually want to do it. So I feel like there's something there that if we all keep talking about it, we can fill those spaces. People feel more comfortable when they see other people. I think nobody wants to be that one person alone sitting there doing all these things and reporting back. They just want to see more of everybody. So the more we talk about it, the more normalizing it is. Talk to it with your white friends, Filipino friends, Asian friends. Talk to everybody. It's everybody's thing, because MS affects everyone. And I feel like the more we know about how it affects every individual, we know more about MS. So it benefits everybody, not just one population. So I would always say, whenever you can, talk about it. Friends, family, whoever you trust, because obviously not everybody wants to speak to everyone about their MS, but whoever you trust and you're speaking to, just talk about it. And that's my main thing, is just speaking.
And I guess if I had a message, first to my colleagues, to recognize that anybody can get MS. We need to be looking for it. We need to be diagnosing it early, because it really does make a difference in the long-term trajectory if we diagnose and at least offer access to treatment early. I think the other messages that are pretty, much in the forefront of my mind are, number one, I'm a big advocate of including the patient voice in the work that we do. So many times as neurologists and scientists, we get in a room and we talk about what the patient needs and what they want, but there are no patients there. So I've had the good fortune to participate in a clinical trial called the CHIME study, which we'll be presenting some data from this year, where we involve patients from the conception of the protocol. And I will tell you, there are some things that we as neurologists were like, no, they're not going to do that. And the patient's like, what are you talking about? No, we want the best study, so making sure that we include that voice in everything that we do, and not just talk about people without them being present. And then the other thing that I have really focused on probably the past couple years of my career is patient empowerment, right? So I certainly educate my colleagues, but some of my colleagues who have, been practicing for a long time may not be willing to change their ways in some respects. And so what I have turned to is providing conversations for neurologists and patient advocates to discuss how to know if you're receiving good care, right? And if you're not receiving good care, to try to find or assemble the right team or get the right resources, right? Organizations such as yours, Natalie, where you can really learn and be an advocate for yourself, and or for your loved ones who have MS. And so, advocating and educating my colleagues, but also advocating and, educating the patients. Listen, if, we talk a lot about firing our doctors here. I don't know if that's the case in the UK as much, but, if you're not getting good care and they're not listening to you and you're doing worse, then, see what other options are there.
I could talk to the two of you for hours, but to keep the episode to a reasonable length, I do have one last question that I want to ask both of you, and I'm really interested in what your responses are going to be to this. We've talked a lot about the momentum that's sort of grown over the past 5 to 10 years. But for both of you coming at it from slightly different areas, what are you hopeful are the positive changes that we see in the next 5 years for Black people living with MS?
I think what I would hope in the next, couple years or moving forward is that there's an increased awareness about MS, like we know about many other diseases in the Black community. We know about high blood pressure. We know about diabetes. We know about sickle cell. I want people to be at least somewhat familiar with MS, even if they don't know all the ins and outs. And then I think as a scientist, I would like for us to really move the needle in terms of reforming some of the ways that we do research to make them more inclusive and not automatically exclude populations of people because of inclusion criteria, because of where the studies are being done, who is the primary investigator of the studies. So I would really like to see the needle moved in that regard from a medical professional standpoint.
I would say over here in the UK and in the rest of Europe, I want the medical professionals to be more intentional when it comes to be more inclusive. I mean, you can say all you want, you can have all your studies. I know I've been in a meeting with a few hospital organisations that's asked for my opinion on how to make, their study more diverse. And I asked them what they do to get more Black people involved or more Asian people involved. And they say, well, we put our leaflets out, we, around the hospital, we do this, we do that. But there's nothing about, okay, but do you, go to places where there's a large population of Black people, Asian people? And they say, oh, no, we don't do that. And it's like, well, that's the problem, because most of the time we have got so many things going on. We don't put our health as priority. So you wouldn't see us hanging about. If we go to the hospital, we'll go to our appointments, we just go to the doctor, we don't ask questions, and we just leave. And I know that my neurologist said that what I'm doing is a great thing, because she's a white lady and she feels that when she's talking to her Black patients, there's something more that she feels that they're not telling her, but they don't trust her to tell her. So she feels like, oh, I want to know more. I know there's some, she always like, are you sure you're okay? Are you sure you don't want to ask me anything? They said, no, I'm fine. They just go. So I feel like it needs to be more intentional. If you really do want diversity, you have got to be in places where Black people are. You've got to change the language, because that's another thing, a language barrier. I do laugh at my family members when you try to tell Africans with their accents how to pronounce multiple sclerosis. It's hilarious, especially when they're trying to pronounce it and stuff. It's so funny. So there's the language barrier as well, communication, things like, there's so many things that go with it. And I think I feel like they generalize that. I think they thought, oh, this is going to be easy. We just say it and go. But there's a lot in the Black community that you have to learn and understand. And I think that's why these organisations are there to advise, because it's not as simple as putting your leaflets out and saying, oh, look, this is a trial, come along. There's so much that goes into it. And I feel like if you are really devoted to that, we have got to be intentional.
We could talk for hours on this, but thank you both very much for your time today to record the episode, but also for all of the hard work that you're doing in this area. I think for the Black community of people living with MS, there's a lot of hope there, considering there are people like yourselves who are out there leading the charge on this and really continuing to fight the good fight on it and raise awareness. So thank you very much for that.
Thank you for having us. Thank you so much.
Thank you so much.
And thanks everyone for listening. Once again, I'm Brett Drummond, host of this podcast episode. I'm also co-founder of MStranslate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community. The ECTRIMS podcast is produced and hosted in collaboration with two key partners, MStranslate and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The ECTRIMS podcast is supported by an educational grant from Novartis, Roche, and Alexion AstraZeneca Rare Disease. Educational grant providers have no input on the podcast series content. You can read more about the topic of this latest podcast episode and more on the ECTRIMS website, ectrims.eu. Do subscribe to the Ectrums podcast on your favourite podcast channels and follow Ectrums on X, formerly Twitter, LinkedIn, Facebook and YouTube.